I'm Dr. Hansen, and today we're going to be talking about dermal fillers and where we use them. Some of the primary areas that we use them for patients is our tear troughs, cheeks, and then we can actually even use up in the brows, sometimes in the temples. Then we can go ahead and turn this way for me. And then we can actually fill through this area. The area between here and here is the auricular fat pad, and then there's actually some buccal fat. So a lot of people, as we age, we lose that volume through here. We lose a lot of it up here. But see how she has a really nice jawline? We can actually rebuild the jawline by injecting volume through here, some through here, and even into the chin. And of course, everybody knows that we can do the lips as well as the nose. So now we're going to talk about actually injecting the cheeks. And as you can see, our model, otherwise known as Megan, actually has good quality cheeks because she's still young. As we age, we lose the bone in our cheekbone called the zygomatic process. That actually decreases. We also lose the fat in there. And then on top of that, as we age, we lose the quality and thickness of our skin. So as we age, that's one of the primary areas. When we lose that volume, it actually allows us, or what it does is it allows the skin to kind of fold over the top. And that's the reason a lot of us will get this fold in there like that. And that's called the nasolabial fold. She doesn't really have much of that, but what happens is that this moves forward because of the loss of volume behind it. So one of the areas I like to fill first, and which is one of the more prominent areas that we actually fill now, is actually the cheeks. So when we're talking about the cheeks, generally we're talking about in this whole area. A lot of people will say, gosh, you know, one syringe, that seems like a lot. But when I'm filling, I'm actually filling that much space. So when I'm filling along what we call the cheekbones, and sometimes I'm even filling all the way up into here. But it's going to take anywhere from a half a syringe for somebody who's younger, where I may only have to rebuild this. But if I'm actually working somebody who's a little bit older, I might end up using a syringe and a half per side so that I can rebuild this all the way up so that we can get that nice lift out of it. Now, another area that's very common for us to fill these days is what's called the tear troughs. The tear troughs can run all the way from out here into here. And so with that, you'll see this basically depression underneath the normal fat pad from the eye, and then we lose this infraorbital fat pad, and we end up with this divot through here that can be seen especially with overhead lights. We don't see quite as much of it because of the lights that we have in here, and also she's young, so she doesn't have much of that yet. So what we do is we can actually use a filler, and I like to use Restylane in here. Some of my staff like to use Volbella. It's nice and soft in the area, moves with the eye, and doesn't cause any trouble by drawing too much water to them. So a lot of times we will use just two ports, a little spot out here and a little spot out here to enter through that allows us to get this nice clean lift in there, and we can get that to smooth out quite a bit just simply by using a cannula. And if you remember before, I had talked about using a cannula. A cannula is blunt on the end. It is not a needle because there's a bunch of blood vessels that run through here, and you do not want to inject into the blood vessels. The advantage to using the cannula is that it is blunt on the end, and it will not, in most cases, penetrate a vessel, especially an artery, causing troubles. So what we would do is we would use somewhere between a half of a syringe, which is generally for somebody who's a little bit younger like Megan, that has a little bit of their tear trough deformity that runs right through here. And then for somebody who's a little bit older that truly has lost that infraorbital fat pad, a lot of times I'm going to do one full syringe along this whole area on both sides. And then what I'll do is bring them back somewhere between 1 to 3 months later when I'm sure that all the swelling is down and we can settle in and just do a little bit of cleanup. Sometimes it needs a little bit more on the outside to all the way in here. There are some people who end up really kind of lost a lot of their volume through this area, and I actually will go in and inject that area as well. That's not part of the tear trough. It's actually usually above the fat pad, because if you look at this, Megan has this really nice little divot here, which is the way it should be. It should go from from the lashes down what's called the tarsal plate, which is there's a little cartilage in there, and then it should kind of come out and almost be one piece. So this should flow nicely as one smooth, basically transition from the eye down. A lot of people will lose the volume through here, but they also lose that volume down here. So we have this lumpy version, and that catches the light, which then causes all of the shadowing. So again, somewhere between 1 to 3 syringes over time into that area. Now, another very common area that we do is actually, as we age, this area right through here, and you'll hear people call that the buccal fat or buccal, B-U-C-C-A-L. And this is an area where quite often we actually become quite hollow. Quite often it's almost like a V shape in here. So what we can do is we can come in, I will quite often what's called cross hatching. So I'll come in and I'll make it from different directions, but I'll also come in from down here, and in order to get a really nice smooth lift through that area. Now, also when we're doing this area, it's really important to look back here too. People don't realize that we lose volume all the way back to our ear and even into our scalp. So as we inject, we really want to start looking at this whole area through here. As you can see, I've talked about the cheek, I've talked about the tear troughs, I've talked about the preauricular fat as well as the buccal fat areas. So by adding volume into there, that starts to give us the lift that can lift jowls as well as the nasolabial folds. So quite often when I'm doing this area, I'm going to use somewhere between 1 syringe to 1.5 syringes per side to start. If I've got somebody who's really, really thin and needs lots of volume, I've used as many as 6 syringes, 3 per side in that area. So that's one of the areas. Now, if you think about it, everything is actually connected through here. Now, another very common area for us to do is actually the jawline. And that's kind of right through here. And as we age, our jaw becomes more curved. We lose the actual transition or the volume in it, and it shrinks. And that's part of what happens as we age. So by adding volume along the border, but also I'd like to add a little bit of volume under the border so that I can extend it down, because as we age, remember, it's going up. So what I want to do is I want to extend that down safely by putting some of that right on the bone through there. And it gives also a nice a nice straight line, which then can give you that kind of what people call a snatched appearance of your jawline. So that would be through here. Again, I'm going to generally use somebody who's really young. I might be able to get away with 1/2 syringe per side, and I would generally use Voluma in this area, but my staff quite often uses Volux, and I use the Volux some too. But then for the average person, I would say is at least 1 syringe per side. There's another area right in here that's called the pre-gel sulcus. We'll all see that as we get a little bit older. And what we lose, there's basically a little ligament that sits in here, and that ligament actually holds that in place. Then the face wants to kind of droop over the top of it, and that's where your jowling comes from. So quite often, as we age, well, not quite often, but as we age, we also lose the bone through here. We lose it across our chin. And this is, again, just one more piece. So what happens is by adding volume into this area, it can start to hide that pre-jowl or that jowling on somebody who's a little bit milder. And so I can actually put some volume in front of it as well as behind it. And then above, it can actually lift that jowl and make that jowl basically disappear. So now another very common area that we will treat is what's called the marionettes. This is an extension into what's called the pre-jowl sulcus. And in most people, you'll find a lot of people chase the line right through here. I don't agree with that. When we're injecting volume, we're trying to mimic what you were in a more youthful state. So if you look at those patients, they've actually lost the volume all the way through here. It is not just in here. So you'll see those people and they can sometimes look a little like a bulldog, or sometimes they'll actually have almost like a square chin because somebody's injected them poorly. So what I like to do is I will actually put a port in here. I actually come all the way down into the area through here, but also out to here depending on their chin, because a lot of people have lost that volume from here to here. And I'll even come all the way up in here, and sometimes even I'll come to midline, so that I can get that, because as we age, we even lose that volume through there. So this is one big area, not just this one little space through here. So often what I'm going to do is somewhere between a syringe to a syringe and a half per side. Somebody who's younger, I can probably get by with 1/2 syringe. And a lot of times I use velour in here. I like velour because it's nice and soft. And guess what? This moves a lot because we talk, and especially Megan. So by adding that in there, and it's nice and soft through there, it will move when they emote, when they smile, when they speak. It's not going to look like there's a filler in there. And that's one of my favorite things to do. Now, chin. Now, as we can see, Megan doesn't need anything with her chin. But very commonly as we age, or there's some people who are even born with it, and you'll actually hear it called a weak chin. I don't like the idea of calling it a weak chin, but that's what people will call it. And what happens is we lose that bone through here, and that bone actually recesses, or we never had it. So by actually adding volume back into there, we can give more of that feminine chin. You will see a lot of women as they age, their chin kind of flattens out and becomes almost more of a masculine chin. So you can see that Megan has a very feminine chin. It's this nice, draws to this nice taper. She's got great volume. And when we look at the lip to the chin, it's almost perfect. So her chin is almost exactly the way that it should be. But for somebody who's got a weak chin or their chin is recessed, that we can actually add some volume in there. You'll see a lot of men will grow a goatee so that they can actually cover that up. So that's a very common area that we've been doing more and more of as people have learned about it. So another very common area, and this is what a lot of women are really looking for, is lips. Now, and you can see with Megan actually has very nice shape to her lips. When I'm looking at the lips, I look at everything from what's called the vermilion border, which is the transition from the red part of the lips to normal skin, but also we look at this, which is the furrow that we form here. And you'll hear people call it their Cupid's bow, which is actually this area through here. So what we're trying to do is when we're doing this, in some cases, in somebody who's more youthful, like Megan, all we would be doing is adding volume. And that's just to give her a little bit more show to her lips. So you would actually see just a few millimeters difference on the lower lip as well as the upper lip. Now, previously, I talked a little bit about, and when we measure from here down to basically the lowest point on the lip, the upper lip should be about 40 to 45% of the show, meaning that the red on the upper lip should be 40 to 45% of the distance from here to here. The lower lip should be 55 to 60% from here to here. So you can see that she's nicely proportioned, and this is the way that it would be. So I'll have women that are like Megan that come in with these really beautifully shaped lips, and what they want is they only want their upper lip done. Well, the problem is if I were to do just Megan's upper lip, what I would end up doing is I would actually cause her to be abnormal. It wouldn't look natural. And people would be able to understand that she has had something done. And so what we want to do is with Megan, we want to build up her upper lip as well as her lower lip to give her that nice consistent look and that 45% upper lip, 55 to 60% lower lip. Now, in an older patient, we also got to look at the borders. And if you see with Megan, she's got this really nice, beautiful border to her lips. It's a perfect transition from the skin to the lips. But as we age, this gets lost. So this will get lost in transition from there to there, and sometimes you can't almost see the difference. So what we have to do is we want to build up the edge of the lips. And so by doing that, that will roll the lip out a little bit, but give more definition to the lip itself. So then in those cases, and somebody who's a little bit older, we're quite often building up here, the philtrum, we're building along the lip border, plus we're adding volume in there. Those patients may require more than one syringe. Like if I were gonna do Megan's lips, I would do one syringe to her lips. I would use either Volbella or Juvenum Ultra, are the most common ones that we use around here, and just highlight what she already has. She's got beautiful shape. She's got a great Cupid's bow. She's got basically perfect lips. Could just use a little bit more volume. So again, as we age, we're going to add volume to the right areas. Now, another thing as we age, thinking of this area, is that we lose the volume through this part of our lip. And so what we would do is I will quite often go in with a little thin layer of filler without making you look overdone, and I will actually put little strands or little beads of the filler in there to basically lift that area out. Then I will actually fill the lips, because that's going to give us some of that lip to roll out. So that's kind of the lips in its own little nutshell. As you can see, it's a little bit more involved than what people think. It's not just anybody can do this and do it well. Now, another very common area that people talk about is the nasolabial folds. The nasolabial folds go from here, and in some cases come down all the way to there. Sometimes they meet all the way into the marionettes. And you can see that she has very little of the nasolabial folds. So what we'll often do is add some volume up into here. And as we talked about before, these places are transitions from one place to another. So this transitions to the nasolabial fold into the upper lip. That's one piece, and it should look natural. I find that sometimes people don't realize they need to fill the cheek. So what they do is they overfill this area. So then the patient will almost have I call it a simian or monkey look, because they have filled too much into there, and it just gives them too much prominence to that upper portion of their lip. And when they smile, you can really tell. So what you want to do is make sure that you're transitioning from here into here. Quite often when I'm injecting the nasolabial folds, which is this area, I also inject a little bit into the upper lip and even through here. Usually I do at least from here up, but most of the time I'm sneaking a little bit of it in here too, because this is one piece. This isn't just one piece here and one piece here. They actually join. And so what I want to do is smooth that whole transition out there, not just stick a bunch of filler in here. So that's the nasolabial folds. Other areas that we will quite often do is the temples. The temples are actually quite often forgotten. You will see patients come in, they've had a lot of volume put through here, big cheeks, nothing below that, nothing above it. So you can tell that they've had something done. Again, it gives them that done look. We got to remember that these are not just simple areas. Everything is joined together. And we have to remember that when we're injecting. So quite often as we age, we actually lose the temple fat in here too. I have one of my staff members that's been with me for, I think, 18 years now. She had 2 children, and when she lost her weight afterwards, she lost just a ton of her volume in there. Even in her 20s, she lost that volume. But as we age, it gets worse. So what we want to do is we will inject a little bit of volume through here. And in general, this is going to take somewhere between 1 to 1.5 syringes per side for the average person. And what we can do is we can lift that up. And if you look from over here, you can see that there's some hollowing through here on her. Hers aren't too bad, but we could add just a little bit of volume. And believe it or not, I would probably do about a full syringe. Now, when I'm injecting here, I'm actually going all the way down to the bone and getting most of the lift. And the advantage to that is it will actually last for much longer when it's way down by the bone. So another thing that we got to transition into is the lateral brow. As we age, our brows actually drop. And so when they drop, part of it is because we lose the bone sitting underneath here. It's the actual upper portion of our eye socket, and it's the orbital rim. So what happens is we lose that, our brow starts to do this, and it starts to sag down, and we'll see the corner of our brow drop. And a lot of that is because we lose that volume, we lose the volume in through here. So by adding volume back into the brow, and sometimes all the way above it, can start to replace or bring that brow back up. You'll see some patients that even can use some in their frontalis muscle or across their forehead. But that's actually a very common place. This is going to take somewhere between a half a syringe most of the time to do just the brows. But if we're really trying to fill above it, it's going to take at least a syringe to a syringe and a half of filler above it. Most of the time, I'm going to use something. I can use like the Restylane Contour up here. I like that because it can raise up. It gives you that nice support. But you can also use your Juvederms and your regular Restylanes up through that area as well. And now, go ahead and scowl for me. She can't scowl a lot because she's had some Botox, guys. So, but you'll see quite often people, go ahead and relax. People will actually develop these furrows through here over time. Now, she's never going to develop those furrows because she's got Botox on board. So, and she will have probably by then had it on for years and even decades. So what happens though is that furrow forms over line. Sometimes it almost like pushes the fat out of it. Even if we do Botox and the muscle's not moving, causing those lines, sometimes we have to go in and put just a little filler in there to lift that up so that the shadowing doesn't show. And sometimes we'll have to do this whole area through there. Most of the time I'm going to use a syringe or so. A lot of times it'll be something like Contour or Juvederm Ultra Plus, or any of the products actually do pretty well in this area. Another area that we've been asked about a lot more recently is actually the nose. People are starting to learn that you can do a non-surgical rhinoplasty. I think I've been doing it for well over 10 years now, and so it's not anything really new. So some of the areas that we can work on in the nose is actually the bump through here, So you get a bump here, and we can actually raise this up, and we can raise this up. So she can see she's got a little bit of a dip in this portion of her nose. I could actually lift that up. I could actually even help a little bit here just to round out the tip of her nose a little bit, as well as we can actually straighten out the nose a little bit. So if her nose were tilted just a little bit, I can actually then give it the appearance of that it's more straight by simply adding some volume to it. And it sounds a little strange, but sometimes by adding volume into the nose, actually in theory making it bigger, I can actually make it look smaller. Now, if somebody's got really wide nares, which is the cartilage that holds the nose out, you can't really change that. But you can change the central portion of the nose to make it look thinner, to get rid of bumps. You know, sometimes the bump through here, we can actually quite often give it more of a straight appearance. We can round out the tip of the nose. Sometimes we can actually change how the nostrils flare a little bit. So if you're interested in talking to us about any of the dermal fillers and the areas that we can treat with the various options, please give us a call at Lazaderm for a free consultation.